But first, our top story this evening. Belleville, Ontario has declared a state of emergency. The city is dealing with an overdose crisis after nearly 24 drug overdose calls in the last 2 days alone. And now the mayor says it is time to act.
It's time for us to take action or come up with a plan, but it's all three levels of government that are going to have to do this, whether it's housing first, but we have to have a plan, I feel.
And we are going to be speaking to the Chief Medical Officer of Health for that area coming up in just a moment. But first, we want to get more on this story. Let's bring in the CBC's Albert De La Talia, who's been tracking really shocking numbers here. Albert, tell us more about what is actually going on.
Yeah, and that decision by Belleville, Travis, as you were describing, follows a pretty terrifying situation in the city's downtown. And just to describe where Belleville is, it's a city of about 50,000, about a 2-hour drive east of Toronto. Officials say 14 overdoses happened in total on Tuesday in the city's core, all between the hours of 2 and 4. And that situation actually tied up all 13 of the region's ambulances. And that situation in part led to the city to declare that state of emergency today. Then by this morning, the city said that number of overdoses had actually risen to nearly 24, and none of those overdoses, I should mention, though, ended up being fatal. Lisa Ali, she's with the local branch of the Canadian Mental Health Association. She talked to CBC News Network earlier about the situation on the ground there.
You know, obviously we have our people who are very vulnerable. They're in distress. They're very concerned for their safety of themselves and others. We also are, you know, having our first responders as well as our healthcare service teams are obviously in distress by seeing the level of drug poisoning that's happening. And so, you know, everybody is very concerned.
So the state of emergency doesn't just mention addiction, but also mental health and homelessness as well. And the message here, Travis, from officials in Belleville to the province and the federal government is that emergency services and hospitals, they're at capacity and that action is needed now.
Action is needed now. And so what does the city want in terms of resources to deal with this? Yeah,
so Belleville's mayor and the city's police chief, they say quite simply that they need more money. They say that all three levels of government, they need to work together on this to come up with a plan. Specifically, they say to address human resources and capital resources to get a handle on this situation. Here's more from the mayor earlier today.
We need more mental health counseling. We need more doctors, nurse practitioners, and so the human capital invested in this. We look at detox centers. We don't have any capital or any facilities that we can turn to. So basically, on any type of overdose, they are admitted to the hospital and put back out on the streets.
The cause here is still unknown, or at least officials haven't revealed more about that. But they have pointed a bit to situations in Ottawa and Toronto, Travis. Animal tranquilizers were found in some of the drug supply here, but it's unclear if that could be behind this current crisis in Belleville.
Yeah, we're certainly seeing a lot of overdoses right across the country, but these numbers in Belleville really disturbing. Albert De La Talia starting us off here in studio on this Thursday. Thanks, Albert. We're going to get more on this right now, and for that we're joined by Dr. Ethan Toumishey. He is the Medical Officer of Health for Hastings Prince Edward Public Health, which includes Belleville, Ontario. We have reached him in Kingston tonight. Doctor, you know, as I was saying, this is a very disturbing situation. Let's talk about the big number here. That's 14 people overdosing in a two-day span. How did it get this bad?
It is absolutely concerning when you see such a concentrated numbers. What we can estimate is that this is a particular toxic batch, but this is an acute on chronic problem where we've seen the increasing impact of the unregulated contaminated drug supply on our communities. So this is a particular high number, and we don't know for those confirmations in terms of what mix of drugs be there, but it's that trend that we've been seeing of more and more of an impact associated with these drugs in our communities for a long time now.
You know, I was with another network, and I have gone down to Belleville to do a story on this. This was about 3 or 4 years ago. It's not a new problem, but why are we seeing this magnitude of ODs right now? And do we know the substance that is leading to some people's death?
So we don't know the substances associated with the events that just occurred. But with that trend that's been occurring over years, and this has had severe impact for years, causing deaths in our community and overdoses for many years now in increasing numbers. But the toxicity of the drugs that are circulating within the community is only increasing, and we see mixes that make it more toxic, but also more challenging from first responders in our health system to respond to. So it'd be both the high potency opioids such as fentanyl, but also other drugs that are being found, other sedative drugs. There's various compounds that have been found, and we don't have a good idea exactly what was seen from this past event, but the toxicity of the unregulated contaminated drug supply is just increasing, and that's leading to such severe events as what we saw.
So, there are, and you mentioned a couple of them, there are long-term solutions here in terms of dealing with the health system and really systemic problems. In the immediate, though, what would you like to see in terms of resources to help deal with this emergency?
So from the immediate, one of the most important things is just from our community that we're all coming together, from those who are first responding, from the healthcare providers, from the community supports, that we're getting together to plan and to address, and that we keep going that up, but also having that connection with those other levels of government, as this is going to be an all of community effort. There's particular needs when we look to the human resources side across a wide variety of things, from being able to provide the first response from the healthcare system and those mental health and substance use services and supports. So it is quite broad. There's deficits in what services are available to help people across, but that includes from treatment services, from access to consumption treatment sites. This is quite broad of what the needs are. Going beyond this, but just to have this conversation as well, destigmatizing the use of drugs so that people can feel comfortable going and seeking help, seeking treatment is important, and making sure that people can access the tools from reducing the harm. So this is such as the distribution of naloxone kits, particularly from public health. That's one of our functions and the community, but the supplies to keep people safe, that they're out there, that the services are available in the community. This needs to happen both in the near term and then to keep going into the long term, because this is a problem that's been developing over years and getting worse and worse. So it's not going to go away anytime soon. So we need to think both what happens now because people's lives are at risk and how we can keep that going for the long term to come.
I know you and the folks on the ground are going to be dealing with this situation for I guess the foreseeable future. We wish you the best of luck. That is Dr. Ethan Toumishey. He is the medical officer of health for Hastings Prince Edward Public Health, which includes Belleville, Ontario. We reached him tonight in Kingston.